everybody. Welcome to another version of the Bruce Singer podcast. Just want to share what this podcast is all about. First, there's no selling on the podcast. This is all about education, inspiration, storytelling. Hopefully, at the end of this podcast, which is a great guest today, you'll walk away with some really key takeaways. And that's the theme. And we're also focused heavily on food, natural health, wellness, beverage, that entire system of food. And today we're focusing more on NHPs and things like that, which you'll learn more about. That's all part of this. And I'm Bruce. I want to tell you a bit about myself. I'm also the CEO and founder of Canada CFOs, which provides fractional CFOs to that industry, that space. And this is a way we do this to bring value to our community and our clientele. And also we help them raise capital as well. So we do a few things in this space as well. And okay, all good. So we're going to talk about today. I have a great guest, Gavin Mah. Thank you, Gavin, for joining the podcast. This is awesome.
Thanks, Bruce, for having me.
Okay, so I'm going to share a bit about Gavin. Everybody knows these podcasts are not scripted, so I've told Gavin if I make a mistake, just jump in, and that's cool. But me and Gavin have a relationship through, we know each other through various organizations, through Canadian Health Food Association. We become good friends. And so I want to share about him. He's the president and owner of Biomed. Biomed, he'll tell you more about it. He's a board member at the CHPA, which is the Canadian Homeopathic Pharmaceutical Association in Canada. He is an advisory council member at CHFA. He is a very strong advocate, and he'll tell you about it for regulatory affairs and government relations. In 2023, his company received Retailer of the Year award, and he's basically achieved numerous awards, numerous accolades and nominations for Canadian health foods, and the industry in general in Canada. So a real tremendous thought leader and a real leader industry. Is doing some tremendous things on the NHP side, which we'll talk about. And I'm really excited to have him as my guest. And we finally got this done. Thank you, Gavin, for coming on the podcast. This is awesome.
Thanks so much, Bruce. Glad I could be here.
Okay. Yeah, please. Great. So let's talk about you first. I'd love to hear your story, because this goes back, like you said, to the 80s. And I'd love to walk us through your story. And can you share, until we get to what Biomed does and what you're up to, and then we'll have a very interesting discussion later on about the landscape, what's going on in today's industry. But I want to hear your story first.
Sure. Well, it all started before even man was on the moon. No, just kidding.
They're back on the moon now, not man.
Back to the birth. Hey, you know what? For this industry, for the natural health products industry, I originally got into it unexpectedly. I walked into the first natural pharmacy in Canada, and that was in 1987. And I was actually, at that time, looking for some products while killing time while a friend was applying for a job across the street. And at that time, I met Harlan Lottie. And Harlan Lottie has been in this industry. He's the first one who added natural health products to his pharmacy chain. And at that time, we were just having simple dialogue about products. And a lot of the products I was looking at, the ingredients in them weren't of the best quality. And we started having this discussion. And he says, "You're right. My goal is to work on getting better products into Canada. And can I show you something?" So in the back of his pharmacy at that time was a vitamin company called Sisu Enterprises. And he had just started this. And he was creating natural products that he felt would have better ingredients and none of the other preservatives or colorings or sweeteners, etc. And more regulated. Because you got to remember, in 1987, and a lot of people listening to your podcast may remember, but a lot won't. This is pre-computer, right? 1987 was punch cards. There was no computer where you were typing in anything to do anything, and we couldn't do what we're doing today.
Yep.
Right? If we wanted to talk to someone, you pick up the phone.
Yeah.
You wanted to send them something, you would write a letter and mail it to them.
There was no LinkedIn.
Different times, Bruce.
Yeah.
And I think it's important that we say that, because now that we're getting into this, and I'm sorry if I stray a little bit, but
It's okay.
in different times, we actually had to communicate different. In actual fact, I believe some of it could be better, some of it could be worse, but it was a different style of communication. So he says, hey, come to the back here. And in the back was Sisu. Now, Sisu had, at that time, only a few products. In the beginning, it was a probiotic. So he had one of the first shelf-stable probiotics and a product called GS500, glucosamine sulfate, which was one of the first glucosamines. But that's where it started. And he says, you know what? What are you doing? Da, da, da. We went through all my story of me going to school and what I was going to become and how I was going to become a bazillionaire. But
Yeah.
it resonated that I should shift. I was actually in real estate law and looking to go to pharmacy, right? So I was looking at becoming a farm because a couple of friends of mine were pharmacists, and they said, "Hey, you make really good money," and I was like, "What's really good money?" Oh, at least $65,000 a year. Well, in 87, $65,000 a year was a lot of money because houses were
Big
only
money.
120, 150,
Yeah, that was big
right?
money.
Big money.
Yeah,
So, a nice car is 20 grand would be a nice car.
yeah.
And but see, this is just give you an idea of how times have changed. So, long story short, there, a couple months later, I start working at Sisu as operations manager. Harlan offered me a position that was created for me, and the salary was, he goes, you know what are you going to make at pharmacy? Let's start you off there. So I started off already making pharmacy salary. I'm like, okay, plus an opportunity to make commissions and bonuses. So I was like, you know what? I'm young. Let's give it a shot. So we did. And it just evolved. So if we look at it that way, Sisu evolved like it was a small little company in the back of this natural pharmacy in Vancouver in 1987. It grew huge after that. I mean, we brought on lines, we brought Heal Homeopathics to Canada, Boron, another homeopathic company.
I
We
know who you
brought
did.
Esther C to Canada. Like we did a lot of stuff. Um, and Harlan's the brainchild of this. He just had this vision. He's a visionary, and he could see it. And a lot of times you need that visionary and then the integrator. So I'm the guy who can make it happen. So in the beginning, I had no vision because this industry wasn't I didn't know it. I was new to it, and it was becoming my passion. But it was Harlan's brainchild and his passion. So he'd come up with ideas and say, "Can you do this?" I can do it. Let's run. So that's what happened. And Sisu grew really, really well. So from that time, 87 to when I left in 95, it grew very well. At which point another person, more people came on board and it decided to go a lot in our level. And that's pretty much how I got into the industry. I can go on to how I ended up at Biomed, but Bruce, I'll let you ask,
No, I got two questions. I'd like to know how you ended up at Biomed. What was your secret then?
when
And to
I
get
ended up at Biomed.
to grow that business, to scale that business, what was the secret? And does that secret still hold today based on the changing landscape that's going on? What was the
Well,
secret? Is there one key secret?
one of the biggest secret in life is to actually have a goal. So a lot of people have loose goals. Like someone says, "Hey, what's your goal in life?" "Oh, to make money." Why do you want to make money?
Yeah.
Right? There's a deeper thing. With that money, well, I want to provide food and shelter for my family. That kind of stuff. That's a better meeting. But for a company, it's like, I want to bring my company to X dollars a month or a year in revenue and da 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 da. And it's actually not just sales, it's actual profitability, right?
Got it.
But Harlan and I, as I got to learn with him, like we'd go out and look at herbs and sourcing herbs, and he'd go, "Hey, try this," and oh my God, what the heck is that? Oh, that's raw white willow bark. What is that? At that time, I don't know. Oh, that's what makes salicylic acid. That's what makes your aspirin. What? I didn't know all this stuff at that time, and not many people would when you're young and you're in the 80s, pre-computers. You can't go to an iPhone and Google it. You can't go to anywhere. You'd have to go to the library to figure it out, right? And so as he taught me this, my passion became more of, hey, let's find the best things for our body. Like if our bodies were, let's say, an airplane, right? And we travel, we go to conventions. Maybe soon I'll see you at the CHFA, Canadian Health Food Association trade show here in April. But also before that, in March, there's the Expo West in Anaheim. But I got to fly there. So now, would we want the airline companies to put so imagine that airplane is our body. Are you going to put the worst fuel in that airplane? This is a fuel that should keep the engine running.
Yeah.
No, you're not going to do that, right?
Yeah.
So are you going to put the worst tires and the worst, hey, you know what? We're not going to use structural bolts or anything. We're going to use, hey, these are twist ties. We're going to zip tie the wings on. You're not going to do that, right? So you're going to make sure that plane is built of the highest quality so that it can maintain flight for a long time. I just found out the other day when I was flying back from Hawaii into Vancouver that some of these planes are 30 years old. And then I looked to say how old the oldest 747 and stuff like this are, which don't go to Hawaii, they're too big, but to go to Europe, because I'm going to Europe soon. And there's some planes over there that are 37, 40 years old. I didn't know planes lasted that long, but they have to maintain them. They have to have some quality. And it's only when they become, if a plane was like a human and you start getting a gimp leg, well, then you're not loading up your plane full of people and flying it across the ocean. Do you know what I mean? So
What you mean?
at that point, I decided that, you know what, I understand what you're saying, Harlan. And if we put quality foods or supplements into our bodies, that's the smartest thing to do. Putting something that has zero nutritional value, like a lot of prepackaged and pre-processed foods do, right? Why are you doing that? That means if it was a fuel, instead of jet fuel that's going to take you across the Atlantic, you're putting something that is diluted or has hardly any nutritional value, right? Because the body really needs only a few things, right? You need oxygen, you need water, and you need nutrients.
Yeah.
Those are the three main
True.
things that your
So,
body needs to sustain life.
so you're so you grew it based on, here's what I hear you saying in several things. One, you had very clear and accurate goals.
Yep.
Okay. And it was a profitability goals included, and your commitment to quality.
Oh, yeah.
Your
Yep.
commitment to quality and understanding, basically you're understanding the consumer and understanding the customer. Because that's part you had
You got it.
my perception
One of the
and
things, if you
deep
go on
under
the goal,
and you also were pioneers in the industry, which also created the opportunity, like your early stage. I mean, I don't know when NHP was. If I can, I'd say, as far as I know, it was vitamin C in 1987. Take vitamin C. I didn't know, but now
yeah.
it's anyway. So let's fast forward, and so take a couple moments because there's something else we want to have time for, which is the NHP. But fast forward. Can you fast forward Biomed? Tell us a bit about how you got into Biomed and what's
Okay.
going on in Biomed. Yeah.
So before I actually, like I said, I left CSU in 95. I had bumped into Dr. Michael Murray and et cetera, and helped bring enzymatic therapy to
Yeah.
Canada. But Biomed, in 1993, CSU was a retail line. But there was a lot of practitioners. There was naturopathic medicine and naturopathic doctors was slowly going, small college teaching it. There's a small amount of naturopaths in Canada. There's a handful, right? I could list them all on both my hands. Or at least the ones who are actually practicing and selling supplements. And Harlan goes, well, we need something that differentiates us because the retail line is retail, but if you have the same product in the retail store as the naturopath is selling, they'll only buy it from the naturopath once. And then they'll go buy it from anyone's health food store, right? So you want to give the practitioner opportunity to have something a little higher quality.
I got it.
So in 1993, the concept, at least that's what I was introduced to it by Harlan, was BioGuard at the time. And it had a little shield, gold and black shield. And it was going to be the professional line of Sisu. It evolved a little bit, and because that one, it wasn't as friendly and didn't look like it would sit on the shelf well, for a practitioner, right? It has to have a different look than retail. And at that time, retail was slapping pictures on bottles. I remember when we first brought Ester C to Canada, we cut out an orange from a magazine and slapped it on the label and took a picture, and that was it. But we never, that label was a cutout, glued on, take a picture, there's your, that's how you got the label. Because computer graphics hadn't evolved. So in 1995, Harlan incorporated Biomed International Products Corp. And it was the professional line to Sisu. And it would house all of the alternative medicines that were at a higher level. And this just didn't include vitamins and minerals. This would look at TCM, Ayurvedic medicine, homeopathy. It would look at everything, right? And that's where Biomed happened. And if we spring forward to 2016, after I had been doing many other jobs, at that point I was director of Canadian Regulatory Affairs for Schwab, and which owned enzymatic therapy, Nature's Way, Integrative Therapeutics, Ascenta Health. They had acquired a lot of companies. So I was director of Regulatory Affairs Canada for them. Harlan and I bumped into each other again. We did this a lot. We bumped into each other around the world many times traveling. But we were getting on the plane. He was sitting in 1A. I was sitting in 1C. So there is no B in class. So we're in the first front. And we talked just like best friends from long ago. Hey, what's going on? I see you're doing this. I see you're on the board of directors for the Canadian Health Food Association. I see you're doing this and advocating for this and this. This is in 2016. And I said, yeah, I am. And he goes, well, are you happy? And I go, what? What do you mean? Of course I'm happy. Look at all the things. He goes, no, are you happy? And this is where Harlan gets me, because he digs it down to, what was your goal?
Yeah.
And the goal was, helping others to be the best they could be, the best versions of themselves, and giving them quality. We were. But he goes, can you be happier? And I go, I don't know. He goes, well, I always thought you were an entrepreneur. When you first started at CC, you had a cell phone company, you had a detailing shop, you had all these other companies as well while you worked with before me. And I said, yeah. But just, the right thing hasn't happened. Well, we got off the plane and we stayed in touch. Well, a couple of months later, he says, hey, I got Biomed here. I don't have time to run it. I'm still running.
Buy the business.
Yeah. Do you want to partner up? So that's what happened. We partnered up.
Congratulations.
And I slowly acquired it until I owned 100% of Biomed. And I love that company. It's like another child of mine.
That's
No
all.
different from the children that, are my natural children.
That's all. Okay. So let's talk about, there's a lot going on in the Canadian landscape for the government, natural health products, et cetera, et cetera, et cetera.
Yeah.
I know the audience would love to hear what's going on. What's the landscape? What can you share? Like, what's the future look like? Should I even get into the natural health products business at this stage of the game? I don't know, but I'd like to hear
That's a good question.
That's a very good question. Okay. So we'll get to that. Share your insights that the entrepreneurs who are in the natural products could benefit. Like
I will.
As a leader in the industry. Yeah. Yeah.
And as I get into that, before I get into that, I want to say, like, a lot of the stuff I'll talk about is available out there. Recently, I've been starting to write for Live Pure magazine.
Got it.
And I told you I mentioned that. And so in this current issue, I am talking about, navigating the changing landscape of the natural health products industry in Canada. And what's going on is, and I think as the election comes more forward, we're going to hear a lot more of this from the politicians, and they're just finding out. Health Canada during COVID decided that natural health products should all meet a certain criteria. And the certain criteria was meet the scientific aspects of modern medicine. Well, not all natural medicine is modern medicine. If we think about my story earlier, where I talked about white willow bark is where you get salicylic acid, which becomes aspirin. It starts from a plant before it becomes a drug, right? So Health Canada is saying that unless you can prove by our new modern methods, have scientifically proven that your stuff is effective, then it's not legal to sell it anymore in Canada. Well, if you go back to Indian Ayurvedic medicine, I mean, how many thousands of years old is that? It actually, from research that I did, Ayurvedic medicine actually predated in written form traditional Chinese medicine, which I even was stunned because I thought Chinese writings were from, whoa, 5,000 years ago. But anyways, we're talking a couple thousand years old. Well, back then it was modern.
Yeah.
These medicines were used by anyone through Asia or South Asia. And then there's also homeopathy, which is newer, right? It's only a couple hundred years old. And which is in Europe. But there's also then indigenous natural remedies, which were in North America before any of us were in North America, unless you're indigenous, right? So now, how do you, something that someone would be taking for generations and generations and passed on, how do you now tell them that you can no longer have access to this because it's not proven safe and effective? What do you mean? I've been using it. My parents used it. My grandmother and grandfather showed it to me. Their grandparents showed it to them. Their great grandparents, and so on and so on and so on. Right? So how all of a sudden does it not become legal and compliant? So right now we have to make sure that we're inclusive of things that are traditional or already in place. Have you heard of homeopathic medicine ever killing someone, or traditional Chinese medicine, or indigenous medicine, or Ayurvedic medicine, or any other? You know what? It could be. I just came back from Hawaii. There's traditional Polynesian medicines, right? It could be anywhere in the world. You could be in Scandinavia. You could be in wherever, right? Who is to say that you can no longer have those? And if you've been using them forever, how many people on this podcast, I bet you everyone remembers the time when they were young,
Of course,
and they had a cough or a cut or a bruise, and their parents gave them some traditional form of remedy. Everyone, I guarantee you, everyone at one point has a story.
of course.
Now you no longer have that, and you won't be able to give it to right now, you can give it to your kids, but maybe your kids can't give it to their kids. So if we don't stop this change now, what happens in the next couple generations? We're supposed to evolve in life. They call it evolution. They said, oh, no, it's evolution. We're evolving the natural health products industry. How are you evolving it when you take away certain things?
So what do we do?
There is a campaign out there. I mean, there's Save Our Supplements. It's hashtag Save Our Supplements. But also if you Google searched it, you'll find it on the web. And you can actually log in and get a media kit. And it'll be on there, and it'll tell you how to get a hold of your member of parliament. Even if it's your local mayor or anyone, or go talk at your PTA meeting at your school. Like, first, it starts with the first step. So for everyone, you have to take that first step before you can walk, before you can run, before you're sprinting and winning a race.
Just gonna ask you a question. Here's my understanding. If you're currently a natural health manufacturer or retailer,
yep,
there's risk now. Am I correct? There's risk. Is there risk of business sustainability that exists in Canada to be a sustainable business? Okay.
So good question. Very good question, Bruce.
So
there is. I've actually, and I'm glad I'm hearing more politicians talk about it lately.
Okay.
That right now, there's all these statistics all over the place. And some of these are a year old, 6 months old, whatever. But there is a number of Canadian businesses who said, if this changes, I'm out of business for multiple reasons, right? One is the hoops you have to jump through to prove that something is modern medicine. You may never be able to prove homeopathy is modern medicine or traditional Chinese medicine or
so what is there advice you can give somebody from your perspective? Like, should I start, if I'm in that field, should I start looking at other products that I should develop and sell? Maybe I should come up with I don't know. That's
a good backup plan, Bruce.
It's a shame to see an industry be attacked. It's absolute shame.
it's a
industry
good backup plan as a
decimated. They can decimate.
business owner. Yes, it
Yeah,
is. It
yeah.
is. As a business owner,
It's
that's a
terrible.
good business plan. But
Yeah.
if you're doing this for the right reason, once again, what's your goal?
What's your goal? Yeah. Yeah.
My goal is to make sure that all Canadians and anyone around this world who wants to
Yeah.
buy a product made in Canada, which Canadian supplements are like the gold standard around the world. People buy Canadian supplements because they
They do.
know of
High
our
quality.
quality of regulations,
Yeah.
right? So they're already doing that. They're buying it in Australia, they're buying it in England, they're buying it wherever you go, Dubai, whatever. They already know that in Canada, the regulations are so good that we know we're getting a quality product already. So now here's the thing. If you want to pivot and say, listen, I'm going to lose some of my traditional medicines. So I'm going to pivot and go to just vitamins and minerals
Yeah.
and stuff that are acceptable and that pharma already says, yeah, these are it. And farmers are already buying them, right? Farmers are already selling their vitamin C's and their stuff like that, right? If you want to go that route and compete and you can, but that's not my vision. My vision is to
Yeah.
provide them
But
the
just,
best
just
alternative
got it.
medicine, right? Realistically, right behind you is a picture, right? It looks like some curcumin and some, what is that? I don't know, green vegetable drink, green drinks, stuff, bananas, pineapples, papaya, stuff like that. So food is the best medicine,
Food
right?
is the
If
best
we had
medicine.
quality food, we really don't need supplements. But the problem is people don't get quality food. A lot of the processed prepackaged foods don't have the nutrients you need. Remember, in the beginning, I said you need water, you need air, you need nutrients.
Correct.
So I know in order for us to provide the proper nutrients, if you did want to pivot, like you said, it's a shame because as people leave the country and say, listen, I'm pivoting it away from traditional medicines, there's no longer the access to Canadians, the 40 million Canadians out there don't have access to natural remedies. So they only can take the
Yeah.
pharma.
Here's what I'm saying. Here's the bottom line. What I'm thinking is keep the fight going.
Yes,
Like
keep the fight going.
that's the sustainable solution. Keep advocating. Keep like I know what's going on in the like I'm a member of CHFA. I'm kind of in the loop of what's going on. You know, when I wrote to my parliament, all these things, right? But you got to keep. And I think I get the impression there's progress. You know, keep the fight going. And
Well, we always hope that there's progress,
yeah,
but you never know until Health Canada passes a law.
yeah,
And right now, Health Canada has the ability to make changes without getting further government approval from politicians, right? They can make these changes. So these changes are happening, but the politicians are getting involved. The people are getting involved, right? If the people make a voice, you can't be the guy saying, you know what, I don't need to worry about it because Bruce and Gavin are taking care of it.
yeah.
They're out there doing these podcasts and they're spreading the word about Save Our Supplements. And I don't need to do anything. No, that's wrong. Because we need it. It's not just one voice. It's all of us come together.
You got it.
There's a famous quote, not a famous quote. There's a quote I love. It's an Al Pacino quote from a movie called Any Given Sunday. And he's in the locker room and he says, we either come together as a team or we die as individuals. Now, if you apply that to the natural health product
So true.
environment in Canada, if we don't all come together as Canadians, all races, religions, and cultures, and whatever background we may have, we come together and say, hey, listen, I don't want to lose natural health products. I don't want to lose an Ayurvedic eye drop that I use to keep my vision, or I don't want to lose a homeopathic remedy that helps with my gout, or I don't want to, whatever it may be, or it's not mine. My mother's, my father's, my brother, my sister, my son, my daughter, right? That's more important because they might not have the ability to sort out these alternative medicines, the natural medicine. So we have to have freedom of choice. One of the great things about Canada is that freedom of choice. So why, out of the first things we're going to take away, is our freedom of choice of
It's a
health?
good very point. It's right.
Right. So Save Our Supplements, I've said it multiple times, Google it, you'll pop up, you're going to see it. And they can go there. There's stuff to download. It says what's going on. It's more than just the regulations are getting tighter to be like pharma. It's looking at some of these traditional remedies being lost. It's also looking at changing labels on product. They're making it so that we have to have like a food label on a supplement saying that there's no fat, there's no, how many calories, all that stuff. It's not that strict, but it's getting that way. So you're going to add this more data, and it's actually not. No one's there's maybe a few people have started it, but what it creates is when you add more information, now you're having more label, or you have to put it in a bigger package. So now we're adding more plastics and
Or
cardboards and
costs, of
increasing the cost, and it
course.
only the cost to the consumer. And so
Yeah,
in the end, the
very
consumer is going
sad.
to go, wait a second, my vitamin C now is $100 a bottle. I can't afford that. I'm just going to go get my free prescription drug from my doctor because it's covered under my medical and take the drug. But we have all heard that,
Or
not all,
or
but
go to the
most drugs.
state, or go to, or shuffle off the Buffalo here in Toronto and stock up. Gavin, this has been a very insightful podcast. You know what I mean?
No,
I don't want to cut you short, but my
all good.
philosophy, we got to keep these short because I don't have the attention span. And my model is to keep it fairly. This has been very, very insightful. And I want to thank you for coming on the podcast. And I also want to thank you for everything you do to advocate. I know you're putting a lot of time, a lot of work into this with CHFA on your own. I know I see the connect. I see that we've talked many times about this, and
Yeah.
you're a strong advocate. Your leadership, I want to thank you for that. And
Oh, well, thank you for having me. You know what?
incredible.
We all have to do our
It's
part. Like,
incredible.
we all have to do our part. And right now, like you said, I actually do spend more time advocating for our industry
A
than I
lot of
do working
time.
my own business.
No, it's phenomenal. And I want to thank you. So before we end the podcast, um, is there any last words that I didn't ask that you want to just cover off for a few seconds? Any
You know what?
final?
I think the most important thing is awareness. And so, anyone listening to the podcast, share the podcast. Uh,
Thank you.
Look up. I'm sure Bruce will put it at the podcast. Hashtag Save Our Supplements and
Yep.
link to Save Our Supplements online. Once you Google it, you get it. But go and take 5 minutes and just read it, and then you'll get a better understanding. Saying, "Wow, I wasn't aware that this is a natural health product." Some people might not be aware. It could affect your toothpaste, your shampoos, your deodorants. Those are also
People don't
natural
know.
health products.
People don't know.
So
Don't
they
know.
have to be aware, and then start talking to your friends and family about it. Were you aware? And that spreads the word.
Yep.
And just say, always believe that, you know what? You want to maintain the best quality of life and best health you have, but you also want that for your friends and family. So share it with your loved ones.
Thank you.
Share it with the ones you don't love, because everyone should have the best quality of life in Canada.
Gavin, thank you so much. As usual, you're always inspiring. Very
Thanks.
inspiring. I love it. I love it. Okay. Everybody, we'll see you next time on the podcast. Take care. Bye-bye.